Spoiler alert, no, you cannot tell if you're pregnant right after you did the deed. In this video, I'll explain how early you could actually take a pregnancy test. I'll also tell you how to correctly interpret the results, sparing you unnecessary anxiety. But first, who am I and why should you listen to me? Hi, I'm Liz, a registered nurse and kinesiologist. On this channel, I talk about all things pregnancy, postpartum, birth, and baby care. My goal is to provide you with as much reliable information as I can to empower you to make your own informed decisions. So hit that subscribe button for more videos and grab my free weekly newsletter where I send you tips and tricks on these topics straight to your inbox. It'll be linked down below. Quick disclaimer, this video is for educational purposes only and not a replacement for medical advice. Let's get started. So let's quickly chat about physiology. Stay with me because this will all come full circle and make perfect sense in just a moment. Around day 14 of your menstrual cycle, when your body releases an egg from the ovary, this is called ovulation. The egg is quickly captured by the fallopian tube where it waits for its special date with a sperm. For pregnancy to happen, fertilization, when a sperm and egg meet, needs to happen within a 24-hour period of when the egg is released. The fertilized egg then spends a few days in the fallopian tube, growing and dividing into something called a blastocyst. After this journey, it implants into the uterus where it's going to develop. And the key point here is that this implantation happens about 6 to 12 days after ovulation. Once implantation is successful, your body starts producing a hormone called HCG, or human chorionic gonadotropin. This is the hormone that the home pregnancy tests actually detect. HCG tells your body that you're pregnant, so that's what is detected on those tests. Because it takes about 6 to 12 days for that fertilized egg to travel to the uterus where it could implant and produce HCG hormone, you cannot tell if you're pregnant right away. There is that 2-week wait. So the earliest that you could actually get an accurate result on a home pregnancy test is about 8 days after ovulation. Taking a test too early might give you a false positive, so it's best to be patient to actually get the correct results. If you see the faintest line on the pregnancy test, that is a positive. It means your body is producing HCG. Remember though, the most accurate way to confirm your pregnancy is with a blood test at your doctor's office. How do you actually take a pregnancy test? Taking a home pregnancy test is a pretty straightforward process, but it is important to follow the instructions that come with the specific test kit to ensure the accuracy. So while most test kits follow a pretty similar pattern, here is a general guide on how to take an at-home pregnancy test. So first, you want to check the expiration date. Before you do anything, make sure that the test is not expired. An expired test may give inaccurate results. Then you want to read the provided instructions carefully before you begin. This will tell you the specific steps, including how long to hold the test in the urine stream or in a cup. To get the most accurate results, it's recommended that you actually use your morning urine, as this is the most concentrated and it'll have the highest level of HCG. Also, avoid drinking a whole lot of water or other fluids before taking the test, because it could actually dilute your urine and lower that concentration of HCG. So to actually do the test, most home pregnancy tests have two main methods: the urine stream method or the peeing in a cup method. For the urine stream method, you want to hold the absorbent tip of the test directly into your urine stream for about 5 to 10 seconds. And the urine collection method, you'll actually urinate into a clean, dry cup and then dip that absorbent tip of the test stick into the collected urine for a certain amount of time. Once you've completed the urine collection step, place the test on a clean, flat surface and the results will show. Usually the tests will tell you how long to wait. In terms of the results, there's usually a line or either a plus or a minus sign. For a positive test, typically there's 2 lines or a plus sign, while a negative result will show a minus sign or 1 line. There are also digital tests that display pregnant or non-pregnant. So what do you do if you have a positive result? Well, it's a good idea to actually contact your doctor or healthcare provider to confirm the pregnancy, because yes, there are false positives and these tests are not 100% accurate. What do you do if you have a negative result? Well, if you have a negative result, but you still think that you might be pregnant, for example, you haven't had your period, it's recommended to wait a few days and do the test again because you may have tested too early. And if you still get a negative result, but your period hasn't arrived, contact a doctor and they'll be able to do a blood test to confirm whether or not you're pregnant. I hope this was helpful. Like and subscribe to the channel and grab my free newsletter down below. I'll see you in the next one.